This guy's being safe. This guy's being safe. I don't know.
All right, bro. Thank you. Okay. Welcome. Hi, my name is Michael Johnson. I'm the co-founder of South Bronx Unite. I live here in Mount Haven, like most of the folks who are behind me. We're here to talk today about congestion pricing. You know, from the congestion relief zone that's taking place now in Central Business District in Manhattan. We know if that project is successful, like they're hoping it will be, from the assessments done by the state, that we're looking to bring in 4,000 more trucks and vehicles and cars to our community every day, traveling and adding to the congestion going and traverse through our neighborhood right now. We already have 1 in 5 of our children have asthma. We have asthma hospitalization rates 20 times that of Lower Manhattan and Midtown Manhattan. We have 350 plus students right behind me in that dream school walking out here every day in a very vulnerable situation where right now the air quality here, as we have monitored, is bad. We know that the increase in PM 2.5, black carbon, and all the gases are deeply impacting our health. We're a community that have been suffering the burden for what New York has done to relieve congestion in other places, or having us shouldering the burden for fossil power plants, waste transfer stations. All that is too much for one community to handle. Right behind us is the largest waste transfer station in the city, handling all the Bronx waste right here. We are inundated with traffic. There's an inequity in air quality. It should not be based on the color of our skin or where we live, on how we breathe and how our kids can survive and have healthy outcomes. We are calling for justice. We're here at the eve of Dr. King's birthday, where he fought and sacrificed for justice. This community needs justice. We've been ingesting, digesting. We are sick and tired of living in this way. That our children who are in this community have been plagued with this problem for way too long. You're going to today be able to talk to community members. You'll be able to talk to some science, our research partners, just about how we've been impacted, how that impact on our health is affecting our lives and how it's affecting the lives of our children. With that, I want to pass it right now to Nita Bell, who's head of the registered nurse, the head registered nurse at the adult asthma, pulmonary and allergy clinic at New York City Health and Hospital. She's at Lincoln Hospital, where she works, and she lives right here in Mount Haven.
Woo! Let's go, Jonita.
Welcome, everybody. Thanks for coming out to hear us. Yes, my name is Jonita Bell. I live and work in the community as a registered nurse now, and I have been for 20 years taking care of people with asthma. In this community, we overburden it with air pollution, and we know that air pollution is one of the main indicators for any lung disease. We are surrounded by 5 highways and a lot of waste trucks are behind here. And I have seen so many of my patients have poor health care. I've seen children die in my arms. I have seen adults with COPD and any and every kind of lung disease that you could think of. And other people in other areas have less frequency of these lung diseases. We have children in schools right here. It's 2 schools right here by this highway. What I'm asking for is support and be fair with this community. The MTA already mentioned, they said that the community go. Where would people go? They would go to the outer boroughs, and South Bronx is one of the outer boroughs. So we would have more congestion, more fuels from trucks, more air pollution. We had enough in this community. Please, let's speak fairly, suggest other methods of congestion pricing, like maybe increase or improve the transit, maybe having a water taxi here, so we can decrease the smoke from the trucks and all the pollution that's in this area. Thank you for listening.
Right now, I want to introduce you to another community member who's been living here for more than 5 decades. This gentleman, he operates one of the largest community gardens here in Mount Haven. He's a head gardener. He's given his all for this community, but because he's lived here all these years, he's been adversely affected by how poor our air quality is. Brother Danny Chevroni.
Woo! Good morning.
Born and raised in the Bronx. I knew when I was a kid I had asthma, but I didn't have a problem with it. Why? Because there wasn't no pollution. Less cars, less of everything. So now, at this stage of my life, I have COPD. I'm in and out of the hospitals on a regular basis. Used all the medicines that they have. Last resort, they have it's an insulin, a needle, which I'm thinking about it. But the problem is that the kids that are growing up, you know, just like we had the problem with Fresh Direct, in the hospitals, all these kids are walking in there with respiratory problems. And when that, you know, years ago they wouldn't have that problem. Now it's like it's out of control. You know, and the communities that don't have money, those are the ones that are suffering. You know?
We also want to have Stephanie please come up. She's a parent here and might even live here, and want to have her say a couple words.
Yeah, I just want to say that this is not something, just like Michael is telling us, it's not something that's happenstance. It's not something that's just coincidental. It's very much intentional, and it's something that can be mitigated through the work that South Bronx Unite does in trying to increase more green spaces and trying to mitigate trying to monitor our air quality so that we know what we're aware of. A lot of people mention the Bronx and we don't know what a computer looks like, but we do know what bad air quality looks like. We know what pollution looks like. We know what heavy traffic looks like. We know what congestion looks like. And we deserve, and our children deserve, an environment where they're healthy. We know that this is not only affecting our health, it's affecting parents economically, working in education, seeing how kids miss frequent days of school because of their asthma and because of the health issues. That means parents have to stay home from work. That means parents have to incur the cost of those medical expenses. And we know that the outcomes of having poor air quality affects our mental health, that it increases your risk of Alzheimer's and dementia. So these are things that need to be remedied. The Bronx deserves better.
Woo!
You know, for communities like ours who've been oversaturated, shouldn't we be looking at how we mitigate situations in communities like ours first? Right? We are for reducing congestion. We just can't be the shoulder bearers for when they reduce it at other locations. Our community is suffering. You've heard from our members. Now you're going to hear from one of our science research partners at Columbia Medical School of Public Health, Marcus Colbert, about the data that we've collected. Hello.
So at Columbia University, we are very well aware of the fact that the South Bronx suffers disproportionately from traffic-related air pollution and traffic-related noise. Perhaps everything started with the construction of the Major Deegan Expressway, which is back there in 1939, and not soon afterwards the Bruckner Expressway was constructed. And perhaps one of the biggest sins committed was that row homes were razed and replaced by high-density public housing next to the traffic emission sources. Since 1939, pollution sources have been continuously added. Even in 2018, a last-mile warehouse opened on the waterfront back in the South Bronx. And that's actually when the collaboration between South Bronx Unite and Columbia University started. We conducted a pilot study to assess the environmental impacts of this last-mile warehouse on traffic and air pollution here in the community. And we actually saw very significant impacts on certain streets in residential neighborhoods. We found traffic increases during the nighttime that were on the order of 30%. So now, last week, despite the new cumulative impacts law, congestion pricing was implemented in New York City, and we have again partnered with South Bronx Unite in order to assess the impacts of this new policy. We will be using data that is being collected right now by South Bronx Unite in the community here. So it's an air monitoring network that is funded by the Department of Environmental Conservation. And we have already started analyzing the data. We have been analyzing the baseline data before congestion pricing went into effect. And specifically, so I just give you one snapshot of the data. The analysis is still in progress, but we have been looking at 24-hour daily averages of the fine particulate matter concentrations, which is also known as PM2.5. And these 24-hour averages give rise to the air quality index that has been introduced by EPA. And oh, thank you. So what we have been doing so far, we have been comparing air monitoring locations here in the South Bronx to a control location in a more affluent area in the Bronx, and what
Riverdale.
In Riverdale. And what we have found from the 2 months worth of data that we have been analyzing for the summer of 2024. So at that control location, the number of days where air quality was good was much higher than the number of days where air quality was good in the South Bronx. So just to be a little bit more quantitative, so out of the 60 days that we analyzed, about for 40 days there was good air quality in Riverdale, while we had, depending on the exact monitor, there was good air quality for 20 to 30 days here in the South Bronx. So we are hoping, no, we are planning to use this data and future data that is currently being collected in order to assess the impacts of congestion pricing on health here in the community. And from our previous work on the last mile warehouse here in the South Bronx, we know that the impacts can be significant, but the data will show what the impacts will be, and we look forward to continuing our collaboration between South Bronx Unite and Bruckner University, and also with the community, so who assisted with our previous studies. Thank you.
But the question is, why do we have to monitor our air when we know increase in traffic will cause poor air quality? Why do we have to prove up our condition? It's well known this community is named Asthma Alley. Why is that? We don't have to, we should have to prove it up, but we're willing to do that. We know that they're moving projects in our community without full environmental impact statements, old or none at all. That's an injustice. That does not happen equally in other places around the city because of where we are treated that way. We don't want to continue to be a sacrifice zone. We're advocating for better outcomes for the people who live in our community, for our children, so we can all breathe fresh air, regardless of where you live. So if you want to reduce congestion, please do it here. Do it where we're breathing toxic air. Do it where our children are breathing toxic air. Do it where our children are missing school or their cognitive development is being impacted by the air they're breathing. We must be better. We must fight for equality and justice for everybody. Don't leave us behind where we're the only ones who shoulder the burden for everything Manhattan or other parts of the city do not want. Thank you all for coming. We continue. You'll hear more about our data as we get more information in. Thank you.
The house without his back. pay $80 for it. And my portable nebulizer machine. And I have to carry my vials of albuterol medicine. I put the liquid in with my mask on, and it helps open up my lungs. And when I'm at the house, I'm okay. When I come outdoors, I have to use it at least 3 times a day. I cannot be around people that smoke. I can't be around people. Aerosol sprays, perfume, cologne. It's gotten so bad where I would love to leave the country, but guess what? I can't afford it. So this is my life now. I can't really live. Thank you for being here. Thank you for sharing, man.
Thank you.
Yes, we don't have got questions. Yes.
I wanted to ask you about legal recourse. I mean, the state is knowingly pushing more traffic into this part of the Bronx, right, with their own assessment. Try to combat the pollution just by the fact that they realize they're doing this. Have you explored legal recourse to try to address the situation?
Well, I want to thank you for that question. I think it's really around the mitigation measures that the NPA is saying they'll do because they know what will happen here. You know, people are creating an asthma clinic here. An asthma clinic's not being created anywhere else. Not in Lower Manhattan, not in Midtown, not in Central Business District, right? They also want to put air purifiers in schools running that are built adjacent to highways. Are they doing that anywhere else? If they know that problem is already pre-existing, mitigation after the fact is not helping. We need real solid solutions today. So far as like litigation, we are making sure we have data collected so we're prepared to whatever means necessary, by any means necessary, to create better outcomes for our community, for our children, for my brothers behind me, and so many others like him who are living here. There's only one tool. It's also making sure we can stand up and fight back against and give information around why this injustice is taking place. But asthma clinic is not the answer. Nita spoke about what's happening at Lincoln Hospital right now. To build a big facility for asthmatics right now, because you know more is coming, it's a slap in the face. It's also really insulting. Yes.
So the NTA
What's the street block? Go into the police block, please. Vehicles before. My brother mentioned Fresh Direct. Their MOUs and the borough president, when they came in, said we're going to electrify our fleet so we won't have a heavy environmental impact on this community. They did not do it. So what we want, reduction in congestion. We want reduction in pollution. We want reduction in CO emissions. We want to breathe fresh air. We don't want promises that are not being fulfilled. So until that's realized in a real, a tangible way, we are not taking it for a fact that it's going to happen. We can't rest on those promises. We're a world that has nothing but broken promises. What we're looking for the NTA to do is to not continue to dump on us. Don't do what's been happening over and over again expecting different results. You know that's the definition of insanity. We want the NTA to do, don't promise mitigation measures when that's directly connected to revenue generated by congestion pricing. Will we see those benefits? Will we see any change in our ability to breathe fresh air? they have a responsibility as a state agency not to do any harm. Right now, they're proposing harm. We want a project that's not proposing any harm on us. That's a problem. You can't put out a project and say we're going to set our assessment shows you're going to be impacted, adversely impacted. Not us. We can't stand for it anymore. Our children cannot stand for it anymore. They're missing days of school, like Stephanie said. Our absentee rates are sky high, 30% due to asthma hospitalization. So that's a problem. It's pre-existing. We should be here. We know from the past. Our community was mostly impacted, severely impacted by the pandemic because of our high ingestion of particulate matter PM2.5. Scientifically proven. So we know that's the situation. How can we continue to bring more of that to our neighborhood, to our community?